I'll share a personal experience. I have a study in the US. It's a small study. It's an area that Allergan actually didn't have the expertise in. So we hired a CRO and partnered with them, and things were going well, and they selected the sites for us. So as a manager, I went out to a site with one of the CRAs for the site initiation visits. When I get there, introduced myself, the coordinator got elated. She was so happy to see me because it's the first time she met an author of a protocol. And she actually asked me to sign her protocol, just for fun. And later on during that day, so we conducted a site initiation visit. And guess what? A lot of questions instead of directed to the CRO, CRA, it was directed to me. So I had to answer a lot of questions. And guess what happened afterwards? They stopped calling the CRO, CRA, because they got my business card, they got my direct line. They started calling me. So this created a slight mild issues with the CRO. They're not very happy with me because the sites wouldn't call them. So I had to do some damage control. So from your perspective, do you have any experience you can share in terms of sponsor trying to make this relationship? Because again, as a sponsor, I would like to keep that relationship. But how can we better work together? And Dr. Deng, you mentioned several issues. The sponsor doesn't know how to maintain this relationship, and sometimes they go out, they may even damage the relationship or you and your company try to establish. They contact sites without even letting your staff know. So sites get really confused as who's their contact, or they don't have enough time for communication, or they just sometimes maybe sponsor just doesn't have enough experience. So can you share your perspective?
I think this reminds me some of the bright examples of Pfizer as a sponsor doing in India. I think ma'am was there in the initial period with Pfizer when those initiatives have been taken in India. I was working with another multinational CRO at that point of time, and we had come back to Pfizer. We were handling some of their monitoring activities, and we come back to Pfizer and suggested this is a very upcoming new industry, and the investigators and sites need to be graduated in terms of training, infrastructure, etc. So the Pfizer was kind enough to conduct a series of GCP programs for the investigators in the territory, and probably Pfizer was instrumental in setting up even an academic institution in collaboration with Bombay College of Pharmacy to deliver training on an ongoing basis for the investigators and for the industry professionals. So looking at the investigator and site are concerned, so the continuous GCP training was one of the initiatives that comes to my mind immediately. And the second thing I can really highlight again from that Pfizer perspective was allowing or motivating some of the investigators to go for certified investigator program of applied clinical ACRP. So Pfizer had spent on behalf of the investigators to motivate them to go and qualify on the ACRP certification program. So these are some of the initiatives. I know they have a long-term objective of maintaining the relationship. They know that they are going to do quality research, and at the same time, they are the prescribers for their product. So with that intention, global pharma companies and sponsors have spent a lot of their money, wisdom, experience in educating and motivating people to conduct good quality research.
And